Good morning. My name is Pearse Keane, and let me tell you, it's a great pleasure to have this opportunity to present at the Vision Monday Leadership Summit, and I only wish that I could be there in person to give this presentation. Now, I'm going to talk today about transforming eye care with artificial intelligence. But before I get into that, I'd like to tell you a little bit about myself. So I'm a consultant ophthalmologist at Moorfields Eye Hospital in London. For those of you who don't know, Moorfields is the oldest eye hospital in the world, and it's also the largest eye hospital in either Europe or North America, and I'm very proud to work there. At Moorfields, I specialize in the treatment of retinal diseases, such as age-related macular degeneration and diabetic eye disease, so some of the commonest causes of blindness in the UK, in Europe, in the US, and around the world. The other hat that I wear is that I'm a professor of artificial medical intelligence at the Institute of Ophthalmology at University College London. And although I'm not a computer scientist and not an engineer, I've somehow come to find myself leading a multidisciplinary clinical research group that aims to develop and apply artificial intelligence in healthcare. And our key idea is that we use ophthalmology as an exemplar for other medical specialties in this regard. Now, as an ophthalmologist, I'm a little bit biased, but I think it's fair to say that ophthalmology and optometry and eye care in general has been at the forefront of this coming wave of AI-enabled healthcare. We know, for example, that in 2018, the first ever entirely autonomous AI system to receive FDA clearance was in ophthalmology for automated diabetic retinopathy screening. In fact, in August 2020, the second ever autonomous AI system to receive FDA clearance in any medical specialty was also in ophthalmology and also for diabetic retinopathy screening. And this was from the company iNuke. Now, my own experience my own journey in artificial intelligence in healthcare really begins back in 2015, 2016. And that was when I initiated a research collaboration between Moorfields Eye Hospital and the artificial intelligence company Google DeepMind. And as part of that collaboration, we were able to share about 1.2 million anonymized retinal optical coherence tomography, or OCT scans, with DeepMind back in 2016. And we were able to work together to develop a deep learning system that could look at these macular OCT scans and identify the most sight-threatening diseases to try to prioritize those patients to be seen by an ophthalmologist or seen by a retina specialist. Now, we worked very hard on this system, and so it was very exciting then in 2018 when we were able to publish the first results of this work in the journal Nature Medicine. And it was a personal thrill that this was on the cover of Nature Medicine. And of course, this being artificial intelligence, you can't escape the hype around it. And so it was exciting that it got global media attention. However, I just want to highlight also, though, that it's also a little bit awkward because although this has the potential to save the sight of millions of people, we're still very much in the early stages of this journey. And so we've completed now the first phase of going from an idea to an algorithm. But the next phase, the longer phase, is about going from code to clinic. So let me take you through a couple of examples from this system. So the first example that I have is from a patient with wet age-related macular degeneration. And so here, if you look at this video, what you can see is that the algorithm has first delineated in yellowish orange a fibrovascular pigment epithelium detachment growing from under the retina. And then in terms of the classification outputs, it's saying urgent referral, choroidal neovascularization. Let me show you another example. So here's a case from a patient with dry AMD, in this case geographic atrophy. And we're all very excited about this in the eye care world because we now have the first FDA cleared treatments for geographic atrophy. And so the algorithm can give very precise measurements of the area and the growth of the geographic atrophy. And the last example I'd like to show is from a younger patient with diabetes, with poorly controlled type 2 diabetes. And what you can see in this example is how the algorithm is delineating the swelling, the waterlogging of the retina, and recommending a semi-urgent referral to a retina specialist. So where are we with the translation of this system now? Well, we're working on doing the proper clinical validation, getting the regulatory clearances, and thinking about how we can integrate with the commercially available ophthalmic imaging systems. And that takes quite a while to do. Alongside that, we're also building a new centre for advancing eye health that brings together Moorfields and UCL's Institute of Ophthalmology. And we're trying to have the flexibility in the design of this centre so that we can take advantage of the new patient pathways that we think artificial intelligence is going to allow in the coming years. However, for me, the really exciting thing about the artificial intelligence work that we've done so far is the promise of AI to bring world-leading expertise out of specialized centres such as Moorfields and potentially into the community and nearer to the homes of patients in the future. So for me, these AI systems are about empowering optometrists, empowering general ophthalmologists, and empowering other eye care professionals to be able to identify those patients with the most sight-threatening disease and in turn save their sight. Now, there's another aspect of the work that I really am excited to give you an update on. We have a program of work which is focused on something that we call oculomics. And this is the idea that we can use the eye as a window to systemic health. There were some exciting results published just a few years ago where researchers showed that you could take a retinal photograph and using a technique, an artificial intelligence technique called deep learning, you can actually say whether this is a man or a woman just from a retinal photograph. You could predict the age of the patient just from a retinal photograph. And using deep learning, you could say whether someone smokes or not, whether they've got diabetes or not. You can even give a pretty good measurement of their blood pressure directly from a retinal photograph. Now, you may say, well, what's the point of that? There are easier ways to tell if it's a man or a woman than applying AI to a retinal photograph. But the reason why eye care professionals have gotten so excited about this is because that's not actually something that we were able to do. I have looked obsessively at retinal photographs for nearly 20 years, and I can't begin to tell whether it's a man or a woman just from the photo, but the AI system can do it with almost 100% accuracy. And that suggests to us that there's a lot of biological information that is actually still locked within these high-dimensional images, and maybe with the right tools and the right techniques, we can begin to tease that out and get new insights and develop new treatments for these patients. Now, at Moorfields and at UCL, we've created a study called the ALSI study. And in this study, we've essentially linked everyone who's had imaging done at Moorfields over a 10-year period with a national database within the United Kingdom called Hospital Episode Statistics. So in effect, we now know if you've had an eye scan at Moorfields and then you've moved to a different part of the country and developed Alzheimer's disease or had a stroke or had a heart attack or any systemic disease, we have that linkage. And so we're excited about the potential of AI combined with this unique data set to unlock this field of oculomics. Now, just to emphasize, we're still in the really early stages of this research, but we've already published a couple of papers which we think highlight some interesting findings. So at the start of 2023, we published a paper in JAMA Psychiatry where we described subtle changes in the retina in patients with schizophrenia. And then towards the end of 2023, we published a paper in the journal Neurology where we showed changes in the inner nuclear layer and the ganglion cell layer of the retina in patients with Parkinson's disease. Now, one of the cool things about this research was that we actually found those changes were present very subtly on average 7 years before the patients were diagnosed with Parkinson's disease. So I think this could be a real game changer. We know that in the UK, when you're aged between 40 and 60, you get a message on your phone inviting you to go to your family doctor and have your National Health Service cardiovascular health check. But we know that actually most people don't take that up. However, in the same age group, we know that most of these people will go to their local optometrist to have an eye test. What happens if we could actually pick up some of these systemic diseases from a routine eye test? I think there could be massive public health implications and public health benefits from being able to do this. So in conclusion then, I hope I've given you at least some evidence that artificial intelligence has the potential to reinvent the eye examination for the 21st century, and I'm really looking forward to see how this plays out in the coming years. Thank you very much.